Well, welcome to our video history. Our first person that we're going to interview today is Dr. Jeanne Conry. Dr. Conry is the 64th president of the American College of Obstetricians and Gynecologists. So Dr. Conry, I'm going to start from the start. Where were you born?
Oh my, San Francisco, California.
Did you grow up there?
I did. We lived in California for the first 5 years of my life, moved to Chicago for 3 years, and then back to California.
So
it's
you've
my
truly
home.
been in California pretty much most of your life.
Most of my life.
Yeah.
Graduate school in Colorado.
Oh, that's right. Well, along the way, when did you decide to become a physician?
Late in my career. I had gone to undergraduate as a biology major, went on to graduate school and got my PhD in biology, and then taught at the University of Colorado for 3 years. And while I was teaching, I decided, I was 25, and on the faculty.
So you had your PhD at 25?
I did.
Well, that's amazing.
Yeah, so I was, looking at what am I going to do next in life, and thought that, as funny as it sounds, medicine offers an ability to teach more on one-to-one, and it offered a lot of flexibility in where I could be, what I could do. So I went to medical school. I applied for medical school only in California. We moved back to California, and I went to UC Davis.
Well, wonderful. I mean, I think you're right. Medicine does enable teaching, and whether you're teaching other physicians or teaching patients, I think that works well. Anything happen in your life that said, I really want to do this, or was it just what the next thing was going to be?
I think it was just what the next thing was going to be. We really, I think being in Colorado gave us, my husband and I was married, well, have been married since Colorado. We were at that stage where we were either going to live the rest of our lives in Colorado and just make that choice, or move back to California. So it was the whole package deal. We were moving back to California, looking at job opportunities and other opportunities, and medical school just was a wonderful opportunity.
Well, what directed you to think you wanted to become an obstetrician gynecologist?
That one's fun. I told my husband that was the last thing I was going to do. So I did my OBGYN rotation as my very first rotation. I really thought I would go into pediatrics, and probably, I would say, first week in OB, I knew that was it. I had 2 children at home and was trying to figure out how do I balance having children and a busy career in OBGYN. And yet OBGYN just appealed to me right from the start, and I never looked back.
Well, that was a great choice.
I've never doubted it.
Yeah. Well, where did you do your residency?
I was a medical student at UC Davis and then residency at UC Davis. So the 8 years there were the best, and it confirmed that I wanted to stay in Northern California. So we bought our home in my final year as a chief, and I started work just 30 miles from UC Davis.
Oh, that's amazing and convenient.
Very convenient, yeah.
You know, so many people are subspecializing today. Did you have thoughts of subspecializing when you
I did. I thought of MFM. I really loved high-risk OB. I was encouraged by the high-risk OB fellows at our private hospital. I was with Kaiser Permanente and loved that, and the UC Davis faculty. But in the end, it was a balance. I had 2 little children. I had never taken a vacation with them, and it was, how much time do you really want to put off in specialty training, or just get going? So
you went straight from residency to Kaiser?
I did.
Have you worked anywhere else ever, or is it there the whole time?
There the whole time. I signed on with the Permanente Medical Group. They don't even do this any longer. I was lucky to be offered a position when I was a second-year resident, guaranteeing me a position when I graduated.
That's amazing. Yeah.
I haven't worked anyplace else. We did take a trip through Northern California. My husband and I put the kids in the car, drove through every community in Northern California, looked at the hospitals, talked with a lot of people, and in the end I decided Permanente medicine was what I wanted, and it offered me a great practice of OBGYN.
Well, you've had a wonderful career there, and how it evolved must be an interesting story. So would you share with us the evolution of your career at Kaiser there?
Sure. Kaiser Permanente offers so much to so many, but people don't understand it. We're the largest health maintenance organization. And back when I started, people didn't understand health maintenance organization from all the other things that were happening in medicine. They looked at as though we were trying to hold down care rather than holding down cost. And we look always at really practicing great medicine, evidence-based medicine, guidance-driven, and a really collaborative practice. So I worked with a team of physicians, nurse practitioners, and eventually midwives. We didn't have midwives when I started. And I was in a small community at the time, Roseville. Since joining Roseville, we are the largest of the Permanentes in the nation, larger than the entire state of Colorado. So we've seen a lot of growth there. And I was an assistant chief in a department of about 12 physicians. Then I was asked to take a different role and oversee all of OBGYN from about 6 different locations. And then I was asked to become what we call an assistant physician-in-chief. So it's a leadership role in Permanente medicine where we oversee a number of different departments and really look at leadership opportunities for the group.
Well, that's exciting, because I mean, so you went from a regular practitioner really into administration.
I did. I did.
What was easier or harder, either way?
Oh, a balance between the two. The hardest part was giving up parts of my practice, and those parts were like peels of an onion where I left parts of it over time. So when I first transitioned into an administrative role, I was doing a lot of infertility, and probably 2 to 3 years into my administrative role, I just couldn't keep up with the infertility program and how much time that took with the patients, and just a predictable schedule for them. And then I did my practice with my same patients the rest of my career. When I became ACOG president, I stopped OB, but then I still delivered a patient after I stopped my presidency. So my last patient, I delivered I delivered every child and grandchild in the family.
Oh my goodness!
And I couldn't stop there. So that's a very momentous last delivery for me.
As I understand today, the Kaiser Permanente system has OBGYNs doing sort of different tracks, but it sounded like you were able to practice the whole breadth of obstetrics and gynecology.
And quite honestly, we partnered with our infertility specialists, our MFMs, so we would rely on them for guidance, but then we would really manage the patient ourselves, and then could call on them if we had problems. Our patients could follow them if they had problems. Same thing with GYN oncology. We have fabulous GYN oncologists, and they kind of let us do as much as we felt we were comfortable doing, and we're always there to provide guidance. I love it as a practice of medicine. It's been absolutely fabulous.
Well, along that way, when did ACOG come into your professional life?
Oh, ACOG started at UC Davis. I can still remember being at one of the big checkout boards at UC Davis, talking about the patients, and one of the residents saying, "Hey, we need somebody to be the ACOG Junior Fellow." I had no idea what that was, and I said, "Okay, I'll do it." And I really didn't know what I'd gotten myself into at all, but I was really fortunate. Dr. Vivian Dickerson was the chair of California District 9, and Vivian has a way of mentoring up. I call it the pull-up technique, where she would see individuals and then just pull you into leadership, offer opportunities, let you do what you needed, and then pull into more leadership.
Yeah, well, that's exciting. So what roles did you do in California?
Because California is its own district and our sections don't have a lot of individual work, I was the junior fellow, chair, vice chair and chair, and then wasn't with ACOG, didn't do anything for about the next 3 years, except I was put on task forces. So the leadership task force, and I know we had one, it was back when we were looking at primary care and medicine. So we had a whole
back in the mid-90s or
yeah,
so.
we had a task force with family physicians in the state, so I served on that, and then was asked to be the district treasurer. We were having a big change in the office, so I took on the position of district treasurer, and did that for 6 years and really brought a lot of changes to the district office. We weren't part of ACOG in a lot of what we were doing. We had our own office in California and had our own finance system. So we became part of the Financial Service Center, and it was one of the best moves we made as a district.
Yeah, because that would have been right around the early to mid-90s too,
Yes.
I think.
Yeah.
That's when the FSC started.
I can't even remember when, 94, 95,
yeah, 94,
somewhere.
95, right after Dr. Hale came, and then he brought Rich Bailey, and that's when the FSC was started.
Yes.
So you've had lots of positions in ACOG, all the way through District 9, and were you secretary and treasurer?
I didn't do secretary. I did 2 terms of treasurer. Nobody wanted to be treasurer, and actually had found my niche and enjoyed what we were doing. And then vice chair, chair, and then past chair.
And then you became president of ACOG.
I did. I know.
And that
highlight of my life.
Well, that's what I was going to ask.
Yeah.
I mean, to have done that had to be a lot of fun.
It was an unbelievable experience. I will say quite honestly, partnering you made it an absolutely fabulous experience. I feel like we got a lot of work done. We heightened awareness of what ACOG does, and it just was 3 very gratifying years. And I say 3 years, as you know, we're President-elect, President, and past President. So working as a team, Jim Breeden was before me.
Right.
So partnering with Jim Breeden was fabulous.
Well, looking back on your presidential experience, what would be the top highlight that you would say of that experience? I know it has to be, there's so many of them.
Well, I would say number 1 is giving the presidential address. I mean, spending as much time thinking about what we want to accomplish. It was Chuck Hammond who gave me the advice as soon as I became president-elect, start figuring out what I wanted to do and how I would do it and work on it right then, because I'd never have time later. And his advice was probably some of the best advice I got. And then, as you recall, my timing was perfect with the Affordable Care Act being passed, right. And then having 2 absolutely wonderful leaders in the Maternal Child Health Bureau in our federal government, Dr. Michael Liu and Hania Trosh, who I'd worked with in California for many, many years. They both moved to Washington.
Oh, they were both in California. I knew Michael Liu was.
Michael Liu was in California, and Hania Trosh was in adopted California. He was with the CDC, but he was part of all of our programs that we were doing, so he felt like he was a Californian. So having the 2 of them move to Washington, D.C., and oversee Maternal Child Health Bureau was an absolutely wonderful opportunity and timing for me.
Well, that I remember fondly how all the things we got done.
We did.
Yeah, a lot of good activity.
And we started with a meeting when I was president-elect. I think you said it was the first time that we had invited the leaders from the Maternal Child Health Bureau to ACOG. So we hosted an entire day there, and it was a brainstorming day, which to me, it was broaching that division kind of between private practice and a lot of our public health policy.
Anything that was really disappointing along the way at ACOG?
Not disappointment with ACOG. Probably the surprise hit, if you will, or surprise for me was the morcellation email that came in. Probably September, so I was new into my presidency. I can't remember exactly when. I associated it with September. And it really showed me the negative aspect of the power of social media. We didn't even have time to talk about science, talk about what we were doing, and social media took over. So I would say it wasn't a disappointment in ACOG. I think ACOG pulled together people, but it was a difficulty, or that was probably a hard time.
It really was, and I echo. I think it really did show the power of social media. I think you're exactly right on that.
Yeah.
We've lived through similar practice times. Where do you see the future of the practice of obstetrics and gynecology?
I don't feel as threatened by pay for performance as I hear my colleagues feeling threatened. I think people worry about being judged in how they practice, and they really don't understand that they practice well. And I see those kind of issues coming forward more. practiced in a group practice my entire life. I didn't have to believe I needed to do a hysterectomy to get paid more. We were salaried. So I think having a salary offers freedom to how you practice and working collaboratively. So I look at a salaried position. I look at certainly collaborative practices with midwives, nurse practitioners, and nurses in extended roles as being valuable. But as valuable is partnering with family physicians. Instead of having a competition, learning how to partner well with them. And then it really gets down to our OBGYN practices. Tracking is hard, and I don't know how I would do with tracking. Tracking is easier when you're established in your career. As I said, the layers of the onion kind of peel away. So I gave up infertility. I eventually gave up general surgery, or surgical practice altogether, and was doing office-based gynecology, doing office-based procedures. So I think that helps. But giving up so much of OB practice is really difficult. Even within Kaiser Permanente, we have hospitalists, but we found a way for a lot of our specialists in OBGYN to still do labor and delivery call. There's a security that comes with it because you're on with a laborist, you're on with maternal fetal medicine specialists, and then you're there with midwives. So it works out, but I think that's the most challenging.
We know the other thing we've seen a lot in our practice times has been a dramatic impact in technology and the way we take and how we provide health care to women. Where do you see this headed? It's so different than it was when we started 20 or whatever years ago.
Well, I think you'll see us having, as OBGYNs, to really focus on helping women stay well. Ideally, many of the tests that we have to do will go away, whether it's a one-finger touch because we can understand our genetic risks and environmental risks and all of those. A lot of that will be taken care of. So I think some of the risk-based practice that we look in and think we just have to get the cervical cancer smear and get them out, that goes away. And the physician has to be able to look at the entire patient and counsel them about their lifestyle, about their risks, about mental health issues. So it's much more of a holistic practice.
One of the things that you have done for ACOG is you sort of guided us on our Women's Preventative Services initiative. And that was one of your presidential projects is to show what a well-woman care should really incorporate. Do you think we're going to have problems getting our graduates to understand that?
Perhaps, but I actually hear from so many of them that they like it, that they enjoy that one-on-one, and I think you like it more when you're working with your own patients. If you're in a clinic where you're seeing random patients all of the time and you don't bond with people, sometimes you don't see the value. But what I hear from a lot of them once they're out in private practice is that's the bond that keeps them there.
Yeah, I don't think people realize how much of a continuity practice obstetrics and gynecology really is.
Exactly.
It's very significant. Do you think there are things we should change in our residency education model to help to help residents be better prepared for that type of practice?
Maybe starting out early, helping them understand that it's lifelong learning. We always talk about lifelong learning, but I think there's such a focus on getting out in 4 years and you're going to be done, that they don't realize that the 4 years are really there just to teach them how to learn OBGYN, and they're going to be picking up new skills the entire time. I don't think you come out of your OBGYN residency ready to practice medicine. So having a mentor in a clinical situation, a surgical mentor, an office-based mentor, all of those help somebody adjust. But we have to really help people understand that it's just lifelong learning.
Yeah, that's very important.
Yeah.
Because things keep changing, and if you don't stay up with them, you really can't practice at the level that our patients deserve.
Exactly.
For us to do.
And I think that's where you find people kind of lost. Even with the electronic medical record, we've heard a lot of negative comments about the electronic record. I can remember the day that we started in our office buying my medical assistant spa package in the hopes that we would survive 1 month. And then after 1 month thinking I would never go back, even if it took more time, the value that I had already seen from it was there. So we have to figure out how to make it even more valuable for people.
Well, you know, earlier in our discussion, you talked about Vivian Dickerson and how she mentored by pulling up.
Yeah.
You obviously have evolved to be a wonderful mentor. How do you help people? How do you mentor the younger folks?
You know, I sometimes feel like I don't do it enough, but I'll give you an example. Dr. Nate DiNicola. If you remember when I took on the presidency and knew I was going to be working in environmental area, he contacted me and said, is there something I can do? And he had just come back from a talk on environmental issues. We found an opening for him, and I feel like I've been mentoring him since then, and I don't need to do anything more. I mean, it's incredible the leadership role he's taken.
Yeah, he's launched.
He is. He's launched. So finding somebody's interested and then just being willing to talk with them.
The environmental issues have become very significant for you. I've wondered if your initial PhD in biology may have had some impact on having you focus on environmental problems.
It's funny you say that because I actually was back at my alma mater, and you know, sometimes when you get a PhD or you're in biology, going on to medicine is too practical and too focused, and a disappointment in some ways. And I remember talking with one of my mentors from my undergraduate years, and he said, I'm so glad that you're back into environmental issues. I don't think I looked at it that way, but I think I was kind of pre-programmed to understand how important it is.
Yeah.
So I have come full circle.
Well, it's interesting.
Yeah.
And now you're having this opportunity to become more involved with FACOG.
Yes.
Tell us about that.
Well, hopefully there will be an election in this coming October for the president of FACOG, and I put my name in the hat. I'm hoping that everything works out. I see an organization that has a lot of potential, speaking for women on a global level in collaboration with other organizations like the World Health Organization, United Nations, and the World Bank. So there's potential there, and an ability to bring the environmental issue forward. You know, I think some people feel like in OB we have one issue and one issue alone, and that if we focus on that, we can't focus on anything else. And we wouldn't get anywhere in our practice if that were it. So I believe environmental issues should be a backdrop for a lot of the discussions we have.
So if you are fortunate enough, and we all hope that you are, to become the next FACOG President-elect, what will be your platform? What will be those issues that you'll do for FACOG like you did for ACOG?
I don't think I'll stray too far from ACOG goals. Honestly, I believe well-women health care needs to be our overriding concern. And when I look back at my presidential address, and my presidential address really talked about the safety in how we provide obstetric care, looking at safety bundles and making sure that we implement safe guidance for everybody. I think the challenge is the access to care around the world. So I see that as a major issue. And then helping women stay well. Helping women, whether we're talking about preventive health care like cervical cancer, breast cancer screening, vaccinations, or violence. I mean, the violence against women impacts every aspect of their life. So looking at that more holistically, and then certainly having the environmental issue front and forward.
Do you think you'll ever really start to slow down and retire, or are you just going to keep charging in new areas for women's health care?
You know, I think this will be a different area. I hope it'll be very collaborative with a lot of help. I'm looking forward to being a grandmother, and that
well, congratulations.
Having my focus be there also. I think there's nothing more exciting in life than enjoying the success and love of your children. I've got 2 children, you know, my son Ryan and my daughter Erin, and then Bruce, who's been helpful through all of this. So being there for my family is still more important than anything else I do.
Well, you know, I think we all have had wonderful careers, and you sound like you've had a magnificent one. Looking back on it, if there was something you could change, what would it have been?
That's probably the hardest question. I never think about it. I'll tell you why. Because even the greatest disappointments in my life, when I thought the world was collapsing, it was the best thing that happened. I just took another course and something great came out of it. So I can't think, I would never look back and say, oh, I shouldn't have wasted my time on my PhD. That I got so much out of that, and really it opened horizons. So I can't think of anything.
Well, that's a great place to be. Do you get the opportunity still to sit down with junior fellows and provide some counseling or guidance for them?
Not enough. You know, I think moving up in leadership at Kaiser Permanente allowed me less contact with junior fellows than I had when I was on labor and delivery, working with them all the time. So the more time I spent doing that, I actually had less time to mentor and work with them. And so if I'm going to look back, it's that one-on-one contact that I've lost. When I talk with some of my colleagues who are in academic positions where you really are with residents every single day, they keep involved.
Yeah. It's always, and it's fun to see them years later.
Yes.
You know, having done some residency education, it's always fun to see your graduates and what they're doing.
Yeah.
Well, is there anything you'd like to tell us that we haven't talked about? I mean, we've covered a lot of ground today. You've had a wonderful career, and we are so proud of what you've done for ACOG and proud of what you're going to do for FIGO. But is there anything you'd like to tell me or tell the people who will be watching this that's unique?
I don't know that it's unique. It's just that I would definitely say ACOG has given me more than I've ever given ACOG. It's been a blessing. You know, whether I look at what we did today with Dr. Ollier and her presidential address, looking at Dr. Brown and what he's accomplished this year, watching ACOG evolve. ACOG is not a stationary organization, and it's evolved beautifully. So watching that evolution take place, the advocacy that we do has made me be very proud to be a member and be part of it. But I can clearly say that ACOG's given me more than I've ever given it.
Well, that's great to hear, and you've given ACOG a lot.
Thank you.
So, Dr. Conry, I'd like to thank you for this opportunity. It's been a real pleasure to chat with you this afternoon.
And I can't thank you enough for being my partner as a presidential officer, and a friend.
Yeah.
Thank you.
Feel likewise.
Yeah.